Good afternoon and thank you for joining me. My name is Abby and here's my audience. Today, I would like to talk about Michael J. Fox and his medical condition called Parkinson's disease. When you hear the name Michael J. Fox, what immediately comes to mind? Did you know that he's Canadian? He was born in Edmonton, Alberta as Michael Andrew Fox in 1961 and later adopted the J in his name in honor to the legendary actor Michael J. Pollard. He is also one of the greatest and most renowned actors in Hollywood who have earned 3 Emmy Awards and 2 Golden Globe Awards for his roles in the TV series Family Ties and Spin City. You may be wondering why I only mentioned the ones I did. The reason is that those years were significant in his life. It was in 1991 when he was diagnosed with Parkinson's disease, 2 years after his role on Family Ties ended. However, he did not disclose his condition to the public until 1998, 2 years after joining the cast of Spin City. And since then, he has devoted himself to the Michael J. Fox Foundation for Parkinson's Research, or the MJFF. His condition led me to delve into the possible causes of his disease, as well as its symptoms and how someone is diagnosed. I also did research on the risk factors involved and explored into the treatments available to help control the symptoms and how Fox's foundation is contributing into finding a better treatment and possibly a cure. First, let's start with the definition of Parkinson's disease. Staff at the Mayo Clinic defines it as a progressive disorder of the central nervous system caused by the loss of cells in numerous parts of the brain that affect one's movement. The researchers of the MJFF also mentioned that the disease was first characterized extensively by an English doctor, James Parkinson, in 1817. It's also noted that the majority of patients diagnosed with the disease are averagely 60 years old, but some has been diagnosed as early as 18 years old. Now that we know more about the disease, I'm going to discuss the related causes and symptoms and diagnosis. Researchers disclosed that there is not a definite cause of the disease. However, they believe that genes in the environment appear to be contributing factors. They said that exposure to toxins and certain viruses could trigger the signs and symptoms. Researchers of the MJFF also believe that in the past 10 years, Parkinson's disease seems to be the cause of a single genetic mutation that is passed on from generation to generation. The Mayo Clinic listed some of the symptoms of Parkinson's disease to include tremor, known as the shaking of the hands or the back and forth rubbing of the thumb and forefinger. Then there's the slowed movement or bradykinesia, rigid muscles. There is also the loss of automatic movements defined as a diminished or lost ability to blink, smile, or swing your arms unconsciously, as it is a normal part of being human. Impaired posture and balance, speech changes, and dementia are symptoms as well. Because there are no definite tests that currently exist, Parkinson's disease can be difficult to diagnose. Diagnosis is mainly based on the patient's medical history and by performing a neurological exam. Next, I will examine the risk factors of Parkinson's disease, which includes gender, age, heredity, and exposure to toxins. Researchers said that having a close relative with Parkinson's disease can also increase your risk, and men are believed to have higher risk than women. Lastly, let's take a look at the treatments available. Treatments for Parkinson's disease can include medication, therapy, and surgery. There are a few drugs that can help manage patients' difficulties with walking, movement, and tremor by increasing the brain supply of dopamine. One of these medications is called levodopa, which is the first drug approved specifically for Parkinson's disease in the 1970s. This drug is mostly combined with carbidopa, and it is converted by enzymes in the brain to produce dopamine. Then there are the dopamine agonists, which mimic the effect of dopamine in the brain. There are also medications that can help prolong the action of levodopa as well as help reduce symptoms of fatigue, tremor, and bradykinesia in early Parkinson's disease. Patients are also advised physical therapy to help with mobility, range of motion, and muscle tone. And for patients with advanced Parkinson's disease, a surgical procedure referred to as deep brain stimulation is performed. The surgery involves an electrode to be implanted deep within the parts of the brain that control movement. Before I end my speech, let's review what I've discussed. I started by informing you a little bit about Michael J. Fox, who is battling a serious medical condition called Parkinson's disease. You may be wondering why I included him in my presentation. The reason is that the foundation he started plays a big part in the research for better treatments of Parkinson's disease. The Michael J. Fox Foundation also shows its optimism to create a cure for the disease in this lifetime. Even though there is no cure for PD just yet, patients can still have the chance to live their lives normally, and Michael J. Fox shows us an example.